Which of the following factors contributes to the development of this infant's jaundice? A 4-day-old infant is brought to the pediatrician by her concerned mother due to yellowing of the skin. The infant was born at term and has been breastfeeding well. On physical examination, the infant appears well with mild jaundice. Laboratory results show an unconjugated bilirubin of level of 9, which is pretty dang high. Which of the following factors contributes to the development of the patient's jaundice? Ooh. Okay. I think a lot of these can cause jaundice. It's just like which one's going to cause jaundice here.
Exactly.
So it's a kid. Nothing to me says increased red blood cell turnover. That's going to be when you're treating cancer. So I'm going to get rid of that one. The E, sorry. Increased bilirubin conjugation? No, because unconjugated is unconjugated.
Yep.
Decreased enterohepatic circulation. I mean, maybe. Decreased bilirubin production? No, because you're making bilirubin. It's oh man, I think yeah, you're making bilirubin. You're just not conjugating it. Decreased albumin binding capacity. Man, I should know. For some reason, my mind is thinking that you would still have to conjugate it first to do that. Decreased enterohepatic circulation. Decreased enterohepatic circulation. I don't know between these two.
What's your gut say?
Um, my gut is saying it's A. I don't like C for some reason. Decreased enterohepatic circulation. Decreased albumin binding capacity. To me, I think it's A. I don't know. I don't know.
Okay, good. So infant's presentation consists of physiological jaundice of newborn, which is common, usually benign condition. Due to immaturity, the liver's bilirubin processing mechanism leading to accumulation of unconjugated bilirubin. One contributing factor is decreased albumin binding capacity of the neonatal liver, which results in high proportion of unconjugated bilirubin in the bloodstream. So yeah. So this is physiological, meaning that kiddos, you have to remember that kiddos can't really conjugate bilirubin really well, which is why always it's unconjugated bilirubin that's high. Usually, I'm talking about newborns, and as
Yeah.
that protein gets better at conjugating bilirubin, that's why we don't really talk about unconjugated bilirubin anemia as you get older, unless you have something like Gilbert's or something like that, right? Not Gilbert's. What's
Yeah.
it called? Is it
No,
Gilbert?
Gilbert's right. Gilbert's is
Yeah,
the one
Gilbert.
that
Okay. I'm thinking about what's the other French diagnosis?
I
What
know what you're talking about.
shoot, what is that? Sorry, my brain just like what is it called? The one that you have ascending paralysis. What is it called again?
Guillain-Barré?
Guillain-Barré. Yeah, that's the other French one. Okay, so I think it's French at least. At least it sounds French in my head. Okay, so but yeah, so that's why they call it physiological is because all kiddos have an issue. Whether they have a little bit more, a little bit less, will determine whether they get jaundice or not. So
Yeah.